So I was asked to speak for a few minutes about ACOR before we start with the patient panel, which I'm going to do. So ACOR is 16 years old now. We started the carcinoid group, I think, about 14 years ago. It's part of a group of over 165 online communities for all types of cancers. Many of the online communities are for rare types of cancer, and carcinoid is just one of them. But the experience that you all have are paralleled by many of the online communities because, as we know, people suffering from rare diseases have great difficulty getting proper diagnosis. And by communicating with other patients, they find information that is almost impossible to find otherwise. So I think that we should start by asking every one of the patients at this panel to tell their story, which I think is going to parallel in one way or another the few sentences I've said. Why don't we start from the left? Would you mind telling your story?
Would you like me to respond to the first question or just briefly do an overview?
Briefly to tell your story as a patient.
I'm Natalie Black, and I live just south of Los Angeles in Orange County. I have lived there my whole life. I had no symptoms whatsoever, and inadvertently I had some just muscle pain in my chest, just kind of like a pulled muscle. And I was leaving town on an extended vacation, told my daughter, who was on my case, "Mom, go see your doctor." "No, I'm fine, I'm fine." "Humor me, just go see your doctor." So I thought I'd call him up on the phone and he'd say, "I'm fine." "No, get your body in here. Good care." Went in and saw him. He says, "I don't know, I don't think this is nothing, but go upstairs, get yourself a chest x-ray." I did that, came down, he took a look, and he said, "Natalie, there's a mass in your lung." Oh my goodness. That wound up being my primary, and you never forget that day whatsoever. Talk about surreal. The very next day, CT scan. The very next day after that, MRI. This was in Orange County, not in Los Angeles, not with Dr. Wolin, who eventually was my doctor and still is my oncologist. Had the biopsy done in Orange County by a pulmonary specialist, and it was confirmed that and scanned my body. There seemed to be nothing else, some nodes here and there. Did lots of research and found there were several centers across the United States. The oldest and the one that had the most research and the largest team at the time was at LSU with Dr. Woltering. I can't see you, Dr. Woltering, where are you? So I was ready to buy my flight to LSU and checked out the other sites, and New York with Dr. Warner, Texas, Anderson, LSU, and oh, by the way, Cedars-Sinai, which was just 45 minutes from my home in Los Angeles. Checked back with my primary physician, who had been a student of Dr. Wolin's in medical school. He said, "Natalie, you go to this guy. He's called the chemist. You will like him." I called the office. I just want to tell you about the finest medical care that exists. I called the office and I said so naively, "Well, I need an appointment with Dr. Wolin." And I had all my scans available. She said, "Well, I don't have an appointment for 6 weeks." I said, "Oh, but I have cancer." Like everybody that calls the office there has cancer. So she said, "Well, I have a cancellation. If you can be in my office tomorrow morning at 10 o'clock with every report and every scan and every MRI, and fill out this 15-page form, then you can come in." I said, "I'll do it." And so I ran around all day through a huge county, got it pulled together, and went in to see Dr. Wolin. And the journey and the saga began as a colleague, a partner who mentored me. He spent all day on and off with my husband and I, and then he began to lead us. That was 10 and a half years ago. I'm a very lucky lady. I've seen, I counted about 10 doctors since then, and a variety of strategies, but basically that's my story. And, I'll tell you more if you want.
Andrew?
My name is Andrew Piskowski. I've lived in northern New Jersey my entire life. About 10 years ago, I had started to put on a little weight, and I got these striae all over my chest and my stomach. And I was actually at my pediatrician, I was 15 at the time, for just a regular checkup. And he said, I believe you have Cushing syndrome caused by an ectopic ACTH producing tumor. So I went to an endocrinologist, and then I had CAT scan, MRI, octreotide, bunch of tests. They couldn't find a tumor. So I continued with that regimen every 3 months, getting the same scans until about 9 months later when I had a bilateral adrenalectomy, which cured the symptoms of the Cushing syndrome. However, there was still a tumor. So I kept every 6 months getting scans. Then about 3 years later, there was something in my right lung. Had that removed. It turned out to be a lymph node. Then about a year after that, during my scans, the whole right lung, the lower lobe, and half of the middle lobe lit up. So I had surgery. I had that removed. And that it was Dr. Bronstein. He actually referred me to Dr. Warner. And that was the first mention, about 4 years after I had originally gotten the diagnosis for Cushing syndrome. That was the first time we ever heard of carcinoid. And since then, I've also had a variety of other treatments, probably seen about 9 or 10 other doctors. And that was about 10 years ago. So.
Hi, my name is Marianne Ritter. I'm 53 years old, retired nurse. I am 53 years old, a retired nurse. I was diagnosed unexpectedly in 2000 with a bronchial carcinoid. I was symptomatic for at least 10 years with the normal symptoms that most carcinoid patients have, as well as a lot of cardiac-related symptoms, high blood pressure, increased weight gain. I had a lot of palpitations, wheezing, flushing. Everybody attributed it to other things, and woke up one morning with a massive pulmonary hemorrhage and a trip to the emergency room and emergency surgery, and found out that I had a carcinoid tumor in the middle lobe of my right lung in the bronchus, which had spread as well to the lower lobe. So I had both lobes of my lung removed at that time, and was basically told that I was very lucky to have had that because it was benign and cured. Decided as a nurse, since I really didn't know much about the disease, to do research on my own, and sought out a carcinoid expert, started doing markers and scans, was carcinoid-free until 2006, when I had a positive octrea scan once again in the remaining stump of the right bronchus. It came back. Wound up at that time having another another thoracotomy where they removed the tumor from my lung. And they felt at that time that they had removed all of the disease, and I was again carcinoid-free for another 3 years until an octrea scan done at that time came back positive again. So at that point, I sought out Dr. Woltering, who is my carcinoid specialist, and they decided at that time that it was prudent to start octreotide therapy. And because I was also diagnosed in 2006 with head and neck cancer, totally unrelated to the carcinoid, which actually came back twice in 2006. So I had 2 surgeries for head and neck cancer as well as the lung surgery for the carcinoid. I had lost 90 pounds, had issues because of difficulties from the head and neck cancer. So we kind of put carcinoid on the back burner for a while. And in 2010, my octreotide scan came back positive again. So it was decided that it was time to start octreotide therapy. And because of my weight and the loss of 90 pounds and not having muscle mass adequate to do the LAR injections that most patients with carcinoid take, it was suggested that I be put on the lanreotide therapy, which is given subcutaneously. But my insurance company did not approve that because it was considered off-label for carcinoid use. So we fought that, and it was finally agreed upon to begin octreotide therapy via an insulin pump, which I use now, and I've been on it for about 8 months now, and it's delivered subcutaneously via a small pump that you wear around your waist. It goes into your belly, you change the catheter every 3 days, and I get a constant dose of octreotide over a 24-hour period, 7 days a week.
Hello, I'm Tony Fierro. I live in Stony Brook on Long Island in New York. My story really starts back in about 2008. With flushing, I started to develop mild flushing and diarrhea. It began to get worse and worse, and in my story, I tried to ignore it. I thought I could just ride it out. I didn't realize it was anything worse than maybe just something I was eating. I tried to do what I could to live with it. But the symptoms got so bad in '09, I couldn't even stay at work. The flushing was embarrassing me in front of my coworkers. I would even resort to going into the bathroom and hiding so that people wouldn't see me when I started to feel the flushing come up. And there was nothing I could do to stop it. I tried wet paper towels on my back and on my face, and nothing would stop it. So I became more and more concerned, more about the flushing than the diarrhea. I thought the diarrhea was something more private and something I could deal with. But it was the flushing that was bothering me the most because it was something everyone could see and it was embarrassing to me. And so I went online and tried to see if I could find some information about flushing. And there at some really obscure website, it listed diarrhea and flushing as being a symptom of carcinoid cancer. And I sat back and said, my God, I've got cancer. I can't believe this. I made an appointment with a general practitioner that lived that was in the next town, and went to see him. I told him of my symptoms, and he immediately turned around and said the same thing. You've got carcinoid cancer. Let me get together with some of my colleagues. Let me do some research through my reference books, and I'll get back to you in a couple of days. And he did. And he ordered me up an octrea scan, CT scan, and also he wanted me to do an endoscopy, which never was done. But they also had done some research into some of the experts in the field, and he gave me a little piece of paper saying Dr. Warner and the phone number. He told me, you've got to call this gentleman. And so I did. And I saw Dr. Warner and was diagnosed by him in June of '09. I had surgery in September of '09, which removed the primary carcinoids, which were in my small bowel, and they had metastasized to my liver. Everything was removed, and the symptoms immediately became better. Since then, I've been on chemo, on Temodar and Xeloda, which ended in February. And actually, I'm starting up again tomorrow on a new regimen of Temodar and Xeloda. That's my story.
Good afternoon, everyone. My name is Claire. I'm 55 years old, and I'm deaf. And that's why she's voicing for me. Okay, in October of 2000, I had a stomach ache. I was having pain in my abdomen. And I thought, oh no, I'm maybe having a gallbladder problem. And it wasn't only that, though. I've been having recurrent problems with my stomach, and my friend Ann said, maybe you better go to the ER. Let's go to the ER. And I thought, okay, let's go. And when I was at the ER, they sent us downstairs for a sonogram. And the result was, they said I had masses in my liver. And after a few weeks, I had a liver biopsy. The diagnosis came back carcinoid. Then in December, we called the doctor who was associated with Mount Sinai Hospital, and he did confirm that, yes, I had carcinoid cancer. When he was explaining to me about carcinoid cancer, I reflected on episodes in the past, and I thought, you know what? I've had flushing and diarrhea for longer, maybe 20, maybe 25 years, longer than I can even remember. I remember I did have problems with diarrhea even when I was in college. The doctor sent me for an arteria scan, and they found that they thought the area of the small bowel was probably where the primary was. And so I started on octreotide. Well, you know, the subcutaneous type. Eventually, my doctor built me up to the long-acting Sandostatin LAR 30. I had 3 HACE treatments, hepatic artery chemoembolizations, at Mount Sinai, 3 different episodes in the hospital, and surgery then, in November of 2001. They did debulking, and they did a resection, an RFA, radiofrequency ablation. The surgeon found 3 primary tumors in the small bowel, and he resected that. And he took out my gallbladder and also my appendix. And so then my physician started me on PEG Intron, and that was 2002, until November of 2004. And then my physician said I had to stop because my liver levels were elevated. Early in 2005, I started with a regimen of Xeloda and Temodar. And I stayed on that until March of 2010. I did have side effects from that medicine, but Celebrex helped. And what happened was that it caused redness of the feet and hands, but the Celebrex helped alleviate that. And now I'm not presently on chemo. I really do want to thank my doctor and my surgeon, both from Mount Sinai, happen to be here, okay.
What an amazing story. What an amazing group of stories. I'm going to ask you a few questions, and we're going to do it the same way. We're going to go from left to right. First question is, from the first symptoms until now, how many doctors have been involved in your care?
I counted them, at least 10. starting from the pulmonary specialist to my primary doctor, Dr. Wolin, liver surgeon who resected my liver after 5 years. There was metastases. The original pulmonary surgeon who resected my right medial lobe. Then I've had radioembolization with an interventionist radiologist about 2 or 3 years ago with a good result. At one point in time, I was on, I think, a phase 2 clinical trial of a Tipramod, and it didn't work, and I got very sick with acute hepatitis, so there were some other physicians involved. I've seen cardiologists because there was concern about that, and there's some kidney issues. I was also taking interferon for about a year along with sandostatin, which I've taken the last 5 years, and there was progression of the disease into the liver, so that was stopped, but the side effects were so difficult for me that I needed to see a pain and psychiatrist at Sinai in order to, so that I just wouldn't lay in bed all day because it really wiped me out. And he put me on Ritalin, believe it or not, and you know, that's kind of magical for an adult. So I put many children on medicine in my work over many years, and so we joked about that. About 12, I think, 12 physicians.
Let me ask you a follow-up. How many, some of those doctors work as a group, as a team?
Yes, all of them. They all talked with one another. Dr. Wolin was the point person that everything was coordinated with, even when I was taken to the ER in Orange County and I was very, very sick and I was taking a Tipramod. They immediately called him and said, what should we do with this? Should we stop it? Should we not? How should we go? So wherever I went, from the stories I hear, I was very fortunate. People were open. People looked for second opinions. When I was first diagnosed with Dr. Wolin, he called Dr. Warner and talked with him, and that's when I first heard about Dr. Warner. And so, yes, there was wonderful collaboration, and people said, well, this is what I think, and this is my opinion. I'm turning it back to Dr. Wolin. He's the man.
I've seen about at least 7 or 8 doctors. That started out with my pediatrician who referred me to my endocrinologist. I also had Dr. Anamnet, an endocrinological surgeon who was at Mount Sinai at the time. Then there was also Dr. Bronstein, the cardiothoracic surgeon who did the 2 lung surgeries. Then Dr. Warner. With Dr. Warner, I did about 48 treatments of chemotherapy that he prescribed with Dr. Fernbach, who's an oncologist, as well as sandostatin. Then once the chemotherapy, it worked while I was on it, but about 6 months once I got off of it, later there was a spot appeared in my right lung. So we went back to Dr. Warner, who referred us to Dr. Odoricio at the University of Iowa, who at the time was doing FDA trials with the lutetium and the yttrium, but at the current moment he could not get any of the, I believe it was the yttrium. So he actually, Dr. Odoricio referred us to Professor Jan Mueller at the University of Basel in Switzerland, where they had been doing the yttrium and the lutetium for years, and him and Dr. Warner helped coordinate my trip there. I had 3 trips there, twice for lutetium and once for yttrium. And then there have been obviously countless other doctors who have assisted them all.
And I suppose they all worked as a team.
Yeah, they've all worked as a team. Dr. Warner's been kind of the epicenter of the wheel, coordinating everything.
There's been at least 10 or more physicians that I've seen over the years. I found it difficult to find an oncologist that was willing to take this disease seriously and really work with other people to try to maintain a proactive approach. But once I did, and having Dr. Waltering to coordinate, the care did make it a lot easier for me and help, make me feel more comfortable about being proactive with this disease.
For me, outside of the initial general practitioner, I saw Dr. Warner and two other members of Dr. Warner's team, Dr. Shafir, the surgeon, and Dr. Zaks, the cardiologist. I also use a local oncologist for my LAR shots. I use two 30-milligram kits a month, and I see him once a month, and he's under the direction of Dr. Warner as well.
Well, I guess when I think about how many doctors have been involved since my diagnosis, I would say 5 physicians, one only for a brief time, and one doctor coordinates all of and works with all of the other doctors. So I'd have to say 5.
And do they all work together?
Oh, yes, 4 of them work together, yes.
So I'll add that this is really quite remarkable because in many of the other ACOR groups, people complain all the time that they have to see doctors that never communicate with one another. So there must be something about how carcinoid is being treated, and I wouldn't be surprised if Dr. Warner is somehow responsible for some of it. Second question is, how long was it from the first symptoms until your diagnosis was established?
Well, as I mentioned before, I really didn't have a symptom. So once I went in to just check out this little muscle pain, which it was nothing, it was right away. I think I just want to say one other thing, which, it's kind of, and I find that dark humor is so therapeutic, is so that, and if you don't have that in your life, you just have to have it. During the medical care, and I go in every 3 months to get a full set of scans and blood work and urine collection, all of that. And one of the times, Dr. Bowen said, I think you need a head to toe. We're going to check out everything, just, good medical care again. Everything was stable with the cancer, but he said, Natalie, you have a brain tumor. And I said, what? What's this? So he referred me to a very eminent brain surgeon, Dr. Keith Black. Many of you have seen him on TV and know him. And he just put him on the phone. Hi, Dr. Black. Natalie Black's on the phone, just right in his office. Talk about access to fine medical care. Well, anyways, I wound up having brain surgery, neurosurgery, to remove 2 benign meningiomas, right frontal tumors that were removed about 5 years after the diagnosis. And while, maybe I'm not quite as focused as I always was, and but I try to fake it as best as I can. But that's just kind of a little intervention that did happen.
It was probably about 3 or 4 months I had symptoms prior to being diagnosed with the Cushing syndrome. It took that long to diagnose, mainly because I didn't do anything about it. I just ignored them, and then when I finally went for a checkup, my doctor said, probably should have come in earlier. But then it took about 3 or 4 more years before I was diagnosed with a carcinoid tumor.
At least 10 years. Again, I was menopausal at the time, so a lot of the symptoms that I had were attributed to being in a menopausal state and pretty much overlooked. So until I really had the crisis situation where I was actually bleeding and they had to intervene immediately was when I was diagnosed.
For me, it was about a year, maybe 18 months, that I tried to live with the diarrhea and the flushing, and then saw Dr. Warner in June of '09.
Well, it's kind of hard to say. Actually, I've had a problem with diarrhea and flushing for so many times, and I thought, well, maybe I'm just fair-skinned, maybe I embarrass easily. Then it started getting worse and worse, and I thought, well, could be because I probably was menopausal, and so that's the flushing. Maybe I eat too much food, maybe I ate the wrong food, and blamed it on one thing or another, and then... So it's hard to say exactly when the symptoms started, but I guess those symptoms might have been for 20 or 25 years, actually.
So there are thousands of rare diseases, and the majority of people wait between 2.5 and 5 years before they get diagnosis. The stories are, for maybe 30 million Americans, this is their story. What did you do when you were told of your diagnosis? Did you research the subject, discuss with your doctor, went on the internet and tried to find information? And follow-up is, what kind of doctor was he or she? A specialist such as a gastroenterologist, endocrinologist, or an oncologist?
Well, I think I mentioned that
Yeah.
before I did the research, and then started with Dr. Wolin at Cedars-Sinai, just with a variety of specialists, and just follow their advice. Just follow their advice.
But did you use the internet to get more information about
Yes.
diabetes?
At first, when I went on the internet, found the various centers, and how I found Dr. Wolin, then I began to do research all the time on the internet. I couldn't read it all, I would find it and I'd print it out, but they tell you everything, and it's kind of scary. I had to do it in little pieces, little piece by little piece, because it was so terrifying, I think. It's like I'm gonna die next Thursday, and with the statistics, and I can read statistics, and then I kept thinking, no, I'm an N of 1. I'm going to be an N of 1. And, but I had to have the research. But it really tells you everything. And I just went around, after I sucked my thumb for a long time and was miserable, I decided that I'm too ornery. I'm not going to die a week from Thursday, and I went around telling everybody, I'm too ornery, I'm hanging around. And that was good medicine.
The first thing I did when I got home was go on the internet and just start searching for everything I could. The next day, my doctor, my pediatrician, actually called. That's what I've been doing. He told me, said, a lot of stuff on the internet isn't true, and he actually suggested against doing that. Because, again, all the statistics, it seemed like I was going to die in a week or two. And that was my pediatrician. And then, so I really didn't do anything until I went to my endocrinologist. And then I just said, he's got the MD. I don't even have a high school diploma at that time. So I'm going to listen to whatever he says and let him do his job.
I as well got most of my information initially from the internet. And once I did that, started to attend carcinoid conferences, joined local support group, started to meet other people who had the disease, and learned to network between those to find as much information as I could, and then sought out a carcinoid specialist to get their opinion and develop a plan of care.
For me, as I described previously, I sort of started the research ahead of time, so I kind of knew what I was in for, even before I got into to see Dr. Warner and his team. So I would say most of my information does come from the internet. I would confirm that there's also a lot of scary stuff out there too. You got to be careful. But it's a really good tool for you to make yourself more knowledgeable and more aware of what's out there.
Okay, really, when they told me that I had carcinoid and it was slow growing, maybe you'd live 10 years, maybe you'd live a month. I thought I had to accept that. I thought I had to accept that that was a fact of life. I thought, well, I guess everybody has to die at some time. But my friend Ann here, she said, no way, you're not going to listen to that. So she started making phone calls. And she looked on the internet and everything, but she really started making phone calls. She did all that for me. But I was like, okay, a doctor said that, so I guess I have to accept that. And so really, I'm very happy to have her, that she said that, and she helped me a lot. And with the Carcinoid Cancer Foundation website, she helped me a lot. And then, but, okay, well, at any rate, what happened was that my friend Ann, she called Sloan, and they said, well, we really don't do much carcinoid, but a nurse, so Ann asked them, well, there has to be somebody, what should we do? And then there was one nurse, and the nurse said, wait, I know that there's somebody, hold on, I'll try to get you his number. He's not here, he's at Mount Sinai. So the nurse gave me the number of the somebody, and what happened was all of Claire's slides and all of the liver biopsy results and all the different pictures and CAT scans and MRIs and things like that, we were able to bring to this carcinoid specialist, and what we heard was hopeful and something very different than what we had heard before. And there are no words to express the gratitude, the feeling. It's almost as if you've been born again when you hear someone who knows, who's certainly a leader in the field, say this. And
So I hear all the stories. You are all exceptional patients who found the information fairly easily, either because of you or because the doctors that you are seeing were informed. There are many patients who are not as lucky as you. And I think that the ACOR group, in this sense, if they can find it, is amazingly useful, because they join the group, they ask a question, and within 5 minutes, someone is going to tell them the specialists for your disease are here and there. I mean, it's almost immediate information that is almost impossible to find otherwise. I just checked. The ACOR group for carcinoid has about 1,100 members currently. So there is a lot of great intelligence, common intelligence from those patients, many of whom have been members for many years and can answer questions. There is a really interesting question. Was any treatment that was recommended not approved by your insurance, and what was the outcome in case it was not approved?
No, it was all approved. Dr. Wolin said if something wasn't going to be approved, he was going to write them a letter, and if they didn't approve the protocol, just bless him, he said, I was going to tell him, this is my protocol, and you better approve it. But everything was approved. But I believe him, he would have done it.
The lutetium and yttrium treatment were not approved by the insurance because they weren't FDA approved at the time, which is why I had to go to Europe to get them. I was a broke college student at the time of the treatment, so my parents paid for it. It was nice, and I got 3 free trips to Europe out of it. So.
The drug therapy initially was not approved. The lanreotide that was initially ordered for me to use, my insurance did not pay for that. They said that they would not pay for that because it was not approved. As well as the pump therapy, it took me 6 months. Thankfully, Dr. Waltering's staff and they were wonderful in helping get the approval for that, because it did take a good 6 months to get that approved as well, but it finally did.
I've never had any problems with insurance company or getting anything approved.
I don't think I did either. I don't think I had any problem unless I don't know if my doctor might have written to my insurance company himself, but I don't know. I never had a problem. And the same with the surgery, right? That was all approved. So we managed with that, so.
Have you had any side effects from the treatments which made you consider stopping the treatment or switching to another treatment or surgery?
Yes, I briefly mentioned I had a lot of side effects from interferon, which was being given for about a year simultaneously with sandostatin. That was very difficult. It was like having the flu every day and just total fatigue. And a couple of drugs were tried. Ritalin helped the most, low dose of Ritalin. It wasn't perfect, but it helped. Atipramod, which was a clinical trial, I just thought I was getting sick and not feeling well, and I didn't go to the doctor right away again. You know, I just have to try harder, you know, to feel better. That's the feeling you get. Just come on, you know, got to do it. And I wound up in the ER, thank goodness, and so they stopped that completely. But I just have lingering, manageable fatigue with sandostatin. Just, you know, it's manageable, very manageable.
Follow-up question, were your doctors responsive to your complaints about side effects?
Yes, yes.
From drugs, I've had, I would say, what you normally consider side effects from them. From the chemo, some mild nausea, which lasted for a day. The worst, I don't even know if you consider it a side effect, was definitely from surgeries, just because the pain lasted the longest. And whenever I got an operation, I'd always wake up and be like, oh, I don't want to do this again, I'm not going to. And then when the next one came up, I'd say, yeah, I have to do this, so.
Compared to the side effects from the chemo and radiation from the head and neck cancer, being on octreotide is a walk in the park, so no, it's fine.
Well, I never had any side effects from the sandostatin. I did have a little bit with the Temodar and the Xeloda, fatigue, would develop pains down my arm or my side, and some nausea, but manageable nausea. I have the anti-nausea pills if it got bad. But other than that, I knew what the symptoms were going in, so I didn't feel like I knew what the side effects were going in, so I didn't feel as though I would be surprised.
And the same follow-up question, were your doctors receptive?
Yes.
Okay, when I first had the first HACE, hepatic artery chemoembolization, I was really sick after that, and I thought, oh, I feel like giving up. But I knew in my mind I had to keep going. If you want to live, you have to keep going. And so the second one again and the third one again, I tried my best through it. And then with the surgery, yeah, that was kind of rough. But the interferon and everything was just sort of mild reactions. And the Xeloda, right, that was the one that caused the red feet and everything. But both doctors, when they were working together, they worked to lower the dose so that it was manageable, so that the symptoms wouldn't be too much, and with my blood levels and everything, so that it was just right, that it was something that I could endure and go on, adding the Celebrex to relieve that. So they worked together, yes. They worked together, and they were responsive to make it work for me.
So it's pretty obvious that the whole group, as a group, You all described that you have pretty good relationship with your doctors and you trust them. I'll tell you that another ACOR group that grew out of the Gleevec trials for gastrointestinal stromal tumor, within a year of creating this group for this rare disease, conducted a big survey among all the members of the group. And what was discovered that has never been published in a medical publication is that patients who suffer from side effects accept suffering from the side effects if they trust their doctors. And those that do not have the trust in their doctors start to lie and do all kinds of things. So, I mean, it's obvious. If you suffer from this kind of disease, go to see doctors that you trust and teams that work together. Last question. What would you do differently if you knew originally what you know now?
Well, I think I would probably have a discussion with Dr. Wohl and I from the time of the diagnosis and the resection of the tumor in my lung. They resected the right medial lobe, and I didn't take any octreotide for about 5 years, and then I found there was metastases to my liver. I think I might have asked or begged for some sandostatin early on. Maybe that would have made a difference, maybe that wouldn't, I don't know. But I just had the surgery, went in for scans every 3 months. When I was graduated to every 6 months for scans, that first 6 months, I realized that there was metastases in my liver. And while I'm relatively stable now, I know I'm going to have more treatments because there's a couple little tiny nodules in my lungs and a couple of little specks in my spine that, are small, but I'll probably have to revisit that at some point in time. And I will.
I would have gone to see Dr. Warner about 4 years earlier, and then that would have changed a lot of things.
Yeah, I agree. Just trying to find the right specialist to see makes all the difference. And if you're given this diagnosis, you really should just get yourself initiated with, a good specialist that knows this disease so they can help you plan out your plan of care.
For me, I sure would have gone out to seek medical advice sooner. I wouldn't have made excuses for myself like I'm eating the wrong things, or I'm too stressed out, or I should stop drinking coffee. I should have listened to my wife is what I should have done.
Okay, if I could have done something different, I don't know. Maybe I'd like some of your Ritalin there. No, I'm only kidding. I'm only kidding. But actually, I'm so happy with my treatment, with my doctor. No, I wouldn't change a thing. Thank God for Mount Sinai and Carcinoid Cancer Foundation.
So thank you, everybody, for coming. I hope the event was thoroughly enjoyable, informative, and if you have an opportunity, actually, I'll request you take the opportunity to fill out the evaluation form. It would make an enormous difference for us, and please don't hesitate to write comments on what you'd like to see next year. We'll make next year even better. Thanks.
Just a very quick announcement.